Hi, everyone. Welcome to Hot Takes, a series from Red Hot Healthcare that delivers thought leadership and strong opinions to viewers and listeners. There's no softball questions or sales pitches from our guests, and I'm your host, Steve Ambrose. Now, today's Hot Take is from Rajeev Ronanki. Rajeev is the CEO at Lyric, an AI-first organization that's squarely focusing on solving payment cycle and transaction challenges to transform consumer healthcare experiences. Formerly the Senior Vice President of Elevance Health and President of Carillon Digital Platform, Rajeev is also the author of the best-selling book, You and AI, A Citizen's Guide to AI, Blockchain, and Puzzling Together the Future of Healthcare. Rajeev, welcome to the show. Thanks for taking the time to be with us today.
Thanks for having me, Steve. Hope you're doing well.
I'm doing well, and I'd like you to go ahead, if you could, before we jump into the questions here, the hot takes, if you could share a bit about your background and efforts in healthcare that brought you to now.
Yeah, might take a while, but here's a quick summary. So I started out in tech and with a computer science degree and sort of squarely being in the tech industry. Original dot-com era startups, and then that led to some work in area consulting, and it just so happened that while I was consulting at the intersection of tech and healthcare, a lot of my clients ended up being in healthcare, and for the last 20 years or so, I've been involved in various elements of technology in healthcare and business transformation, from modernizing core systems to creating better consumer engagement tools to value-based care to applying exponential technologies to now. When you look back, there's been a lot of progress, but I think as with anything else in healthcare, a lot more work still to do.
Oh, that's for sure. And thanks for that. Let's go ahead and jump right in. Raj, I want to throw some stats at you around a challenge in healthcare that is widely impacting millions. And it's actually staying pretty quiet, so we're gonna bring a little voice to it here. And that challenge is unaffordability in healthcare. So, a few stats. A 2022 poll from Kaiser Family Foundation found that 43% of adults report that they or a family member are putting off or postponing needed care due to cost. Another report from KFF estimates that about 41% of our population in the U.S., or 100 million adults, have debt related to healthcare currently. Since the Affordable Care Act in 2010 and the passing of it, insurance premiums for families covered by employer-sponsored plans increased almost 50% to over $22,000 a year. And then a recent Gallup poll noted that about 44% of respondents, representing about 112 million Americans, give healthcare affordability a rating of a D or an F. I'd like to know, do you see any particular way that when it comes to unaffordability and the pricing in healthcare across care services, coverage, specialty medications, do you see a way for AI to ever get to the point where prices can actually become lowered?
Yeah, Steve, I think, first of all, I think those stats are grim and somewhat overwhelming in terms of the magnitude of the problem that we have in front of us. And I think, but I think there's ways to chip away at it. AI and technologies like large language models and things that are in vogue these days. I think sometimes people just kind of tend to overestimate the impact that these technologies can have on any part of society, and including healthcare. That being said, I think working in concert with business model innovation, policy changes, and other things that are needed, artificial intelligence and technologies like that can and will have an impact on costs. And I think here's some examples of how that can happen. One, if you look at our system, the way it's been designed is that there are multiple parties, whether it's government making policy, in some cases providing the reimbursement for healthcare, providers and hospital systems, doctors, clinics, providing care delivery, and actually doing a pretty decent job at that. And then all of the financial transactions that have to sort of emanate from them and into the payer ecosystem where the reimbursement happens, and then the innovation that's happening on drugs and in life sciences and all of the things that are happening in med tech. In some ways, the innovation at the pace of innovation is increasing, while the affordability of that innovation, how we pay for that, I think is often lacking. So if you put all these things together, how do we sort of, start to apply technologies to more effectively address the cost and affordability issue to your question? I think one is, we can automate administrative processes. Things like prior auths that, for the most part, get approved and, get processed as routine. It's only the exceptions that we often talk about. But there's a lot of resource that's dedicated to it, human resources that are dedicated to it, both on the health system side and the provider side that create those requests for service, and then on the payer side where they have to adjudicate and render decisions on that. Could that be automated using AI? Absolutely. There's billions of records of prior precedents around what's approved, denied, and or directed to something different. So AI could be used to automate something like that. AI could be used to automate revenue cycle management, claims adjudication, customer service, and any number of things that are administrative in healthcare. And when you add all those up, the numbers that we talk about are about $1 trillion of waste in the system. And I think while the entirety of it may not be automated via technology, a large part of it can be. And if we start to reduce that amount of waste and overhead in the system, that in turn could translate to lower premiums and more affordability and better access to care across the system. So that's kind of one way to do it. Secondly, the care that we deliver today is for the most part via nurses, clinicians, doctors, and sort of highly trained clinical resources. And we all know that access to those trained resources is at a premium. And we haven't really done a good job of integrating in digital resources like artificial intelligence and sensors and other technologies into the continuum of care at scale. Start to make healthcare more affordable and more widely accessible. So in pockets, those exist. So for example, there are a number of symptom triage capabilities. There's a number of virtual care offerings. There's a number of telemedicine offerings that are out there, which for the most part tend to be, somewhat lower cost than traditional forms of care. And also in many cases, the same or better quality of care. But how do we make those things more ubiquitously available to all parts of our country? For that, we need to have broadband access, available in areas where, there's connectivity problems. And so the basic infrastructure has to be expanded in order for us to deliver care more digitally and virtually. And then connect those ways of care delivery into the broader traditional care ecosystem so that digital care, virtual care, traditional care can all work together in concert. And then systematically in sort of reducing all of the waste and overhead in the administrative processes. You bring all these things together. Absolutely, over the long term, technologies like artificial intelligence can and will reduce the cost of care in the country.
Raj, just to follow up on that, and I've heard this before about, we've got to reduce care, the waste and the fraud and the inefficiencies. But at some level, would you agree that it's going to be incumbent upon the payers and the providers and the pharma companies, let's say, that are involved with this greater efficiency and less waste, when the margins increased, they're going to have to give back to the consumer in some way. In other words, it could turn into profit for these organizations as well very easily, right?
Yeah, I mean, that's the trade-off, right? Which is in being more efficient, you could absolutely make, drive more margin into the companies that across the ecosystem, and that's not a bad thing. I think it could be a win-win where companies could be efficient, more profitable, but also make care more ubiquitously available to the consumers across the country and at a lower cost. So lower cost and more profitability don't have to be at odds with each other, as long as the things that are non-value add are addressed and eliminated from the system, systematically.
In your book, You and AI, you talk about the American healthcare system suffering from a major information sharing problem. And that brings me to the subject of blockchain. Where would you say that blockchain has fallen short of expectations in healthcare? And if we could flip it around, where has healthcare fallen short on better utilizing blockchain technology?
Yeah, Steve, it's a good question. I don't think it's falling short as much as I think it's just in its stage of evolution. There's still some ways to go before blockchain can be more ubiquitously used across the healthcare system. So today there are use cases where blockchain is showing that it can work. It is working. Use cases like provider credentialing, provider directories, making information and medical records available to consumers and to physicians and to payers, using a more common, sort of more efficient infrastructure. All that's sort of working in pockets and in certain areas. The question is, how do we scale it? And so the scaling requires both the maturation of the technology itself, which will take a few years to happen, but also more aggressive push by all of the incumbent players, whether it's pharma companies or providers or payers, to all adopt the technology and make some bets now, so that the exponential effects of these kinds of technologies can start to take effects and start to impact healthcare problems at scale.
According to a new study published in the Journal of the American Medical Association, Internal Medicine, ChatGPT was, and to be fair, Raj, it was a limited study, but it was shown to be better at answering patients' questions and scored significantly higher than actual doctors on both quality and empathy. I think it was 3.6 times higher on quality responses and 9.8 times, almost 10 times higher in empathetic responses than physicians in terms of how they were ranked. So in looking at generative AI technology, Raj, where do you see the guardrails being most needed? And then where do you feel that healthcare needs to be even bolder in moving forward with it?
Yeah, I mean, first of all, I think it's super exciting. I think the ubiquity of that technology and the degree to which it's been adopted already, I think just proves that exponential tech can make progress, and suddenly it's everywhere. And so now we're seeing that with the way that ChatGPT is working, with all the response from Google, with Bard, and other large language models that they're unveiling for consumers and for enterprises. So for us as appliers of that technology, I think we're at a super exciting time. Of course, as with any technology, there's got to be guardrails. The biggest one, I think, for large language models is trust and explainability, and transparency. How do we know that what is being proffered as answers are based on fact, and what are those facts, and what diligence has been done on the source information for us to trust that what's being offered as answers that are very lucid and seem like they're thought through, with references cited on publications and whatnot, that those are all actually accurate. And without that, we can't apply it into areas like medicine, because the barrier and the burden of proof is far higher than perhaps writing an essay for a school test or what have you. So that's, I think, where there's more work to be done in transparency and trust, explainability of the models, and making sure that there's no bias in those models, that all the proper vetting and auditing of those models has been done, for us to adequately base, more refined use cases on these large, foundation models.
And what would you say to all those, such as Elon Musk and other leaders that say, well, we need to put a little stop or a pause on this here and let things catch up? What would you say to that?
Yeah, that I think, I don't think, it's not practically feasible to do that. That's, there's never been a time in our history where, we put a pause on tech. That's just kind of natural evolution of how things work. And so I think the dialogue that we're having now is the right one, which is what guardrails, what checks and balances, and what things do we need to build into the base foundation of these technologies, so that we can innovate responsibly. And I think those are the right questions to be asking. And policymakers, I think technology companies, enterprises, consumers all need to work together in order to make sure that we're using these technologies safely and responsibly. And I think more work to be done in terms of all the guardrails that need to be in place. But I think we should be firmly behind these innovations and pressing the accelerator with the guardrails, as opposed to taking a pause and taking a step back.
Raj, you mentioned transparency before in one of your answers, and I wanted to talk about a recent New Yorker piece written by a physician. And she cited a paradox in greater transparency, or the idea of having greater transparency in healthcare, especially when it comes to the patient portal and the sharing between doctor and patient, a two-way sharing. And she cited that due to the Cures Act and the prohibition on information blocking, that patients are now observing test results and doctor's notes, rough doctor's notes, before the doctors even had a chance to review them. And she went on to say that it's really, in many cases, causing a deluge, a daily flood of messages that are coming into physicians with all sorts of fears and questions and concerns. And it's even posing some challenges in communicating with the patient and managing care. So that said, how do you see striking a balance between technology such as AI and then efficiency, accuracy, and even physician autonomy?
I think I read the article, and I think it was really well written, and I think about a lot of really interesting points. To me, it felt like I think, Steve, having too much information or too little information, I think, are two facets of the same problem. So to me, I think the information being presented, lab results being available in real time, and all of the data being available to consumers, I think it has to be done with the proper user experience and a proper human-centered design, so that people are interacting with this data in a way that is helpful as opposed to confusing, which only then causes the reverse of the actual problem that we're trying to solve with overloading doctors with more questions and causing undue stress and worry to consumers that are already stressed out about their primary medical issues. So to me, I think we got to go back and rethink the information architecture of how this information is available to consumers, and done so thoughtfully and with empathy and with the right human-centered design, so that it's actually helpful to the consumers in the process. And then, of course, there's certain things that require context, the context that only humans can provide. In such cases, I do think that the information flow ought to happen, from doctors and from trained clinical resources to patients, so that instead of just kind of making all this information available, without any context to consumers and causing them more stress and anxiety, we're able to do so in a more orderly and thoughtful manner. But that's not in all cases, right? In some cases, it's better to have access to information and have it more readily available. But so we have to differentiate perhaps what is, sort of the outcome of a biopsy that may have a cancer diagnosis versus something that's a regular routine medical event that could be made available freely. And as long as I think we design a system thoughtfully, accounting for those parameters in mind, I think this could be used to our benefit. And even in the New Yorker's article's case, where ultimately at the conclusion of that, I think the consumer decides not to, get the information from the physician about, his diagnosis. And which is great, which is, again, a consumer choice and not to get that. But as long as that's a conscious choice made by both parties with all the right information available to both parties, that's great. But rather than presupposing that no one needs this information and then making it a black box, which is not the answer, I think that's kind of where the challenge is. And I think what's been lacking is just a lack of a thoughtful, human-centered design approach to all this information that's being made available.
Rajeev, it's great to catch up with you, and I really enjoyed getting your hot takes today. I appreciate you sharing them with us.
Thanks, Steve. It's been a pleasure. Great talking to you this morning.
And for those watching and listening, you can see more hot takes and get every show update by visiting redhothealthcare.com. Thanks, and have a great rest of your day.